And supermarkets are good. They can be really good. They're not always the answer. So that if you have the role of what happens with this market integration on dietary patterns, you'll see that you've got how food is produced and changed and distributed. We have how investment flows across borders, and then we have this whole communication of information and food marketing, and those are three different ways that this greater integration affects dietary patterns. And so when we've talked a bit about these things in general, I don't want to dwell on them. I wanted to give the example of Walmart in Mexico, because we know that Walmart is the largest retail food distributor in the US, right? Okay. Well, Walmex is what Walmart's called in Mexico. These are 2006 data, I think. In 2006, there were 420 supermarkets and discount stores and 209 restaurants in 79 cities. It's increased since then. In 2004, they were investing $625 million to open 77 new stores. They employ more people in the private sector than any other company in Mexico, and any other single company, and they certainly have, Mexico is certainly very much undergoing the nutrition transition and changing, particularly in urban areas. And so they're providing a competitive challenge to other supermarket chains in Mexico. And I don't know if you're familiar with the Carrefour chain from France, but they actually decided, we're not going to try to compete here anymore because Walmart's here, or Walmex is here. So it does tend to kind of proliferate here and there. Is it good? Yes, there's some good things to having it there. Are there downsides? Probably so. But we may not think about them here. So the nutrition transition that I've alluded to is this shift in dietary and activity patterns, as well as changes in body composition, as we move from what's called a receding famine pattern to one that's predominantly nutrition-related chronic diseases. And if we think about how food was back in hunter-gatherer times, and for a lot of the world yet today, it's kind of a receding famine, okay? But we're predominantly nutrition-related chronic diseases. And so what you find with this is not just the chronic diseases, but you've got overweight and obesity that predispose for it, usually accompanied by micronutrient deficiencies. And so an interesting complex of problems that can occur with this. We know that about 60% of all deaths worldwide are due to chronic diseases, most of them diet-related. Okay. We certainly know that those increases are in the developing world. And we're having a hard time coping with managing chronic disease in our health system. Less developed countries don't have the health system. They spend not, $6,000 per person, whatever we spend here, they spend $2 per person on health care. So that they're not equipped to handle this. They don't have the public health capacity. They don't have the resources to do that. We're all going to pay for that. And then the other piece is that these increases are occurring much more rapidly than they did in industrialized countries. We started to see nutrition transition issues here in the US, probably in the 40s and the 50s. And we began to recognize it and start to do something about it. We're seeing those changes, and we're just now in the last 10 or 15 years seeing the obesity and the diabetes and whatever and moving that into children. These changes are occurring in less than a generation in less developed countries. So what does that do to their earning power, to their capacity to grow, their capacity to develop? Just things to think about. And the fact that in developing countries, we know that the poor are at greater risk of various sorts of things, including chronic diseases. And I think, to pull it all together, this is just a model from the literature, but we think about this overall overarching thing with sociopolitical, socioeconomic, environmental context, et cetera, all of those things that are kind of over everything else. We've got our food environment and trade agreements issues with production, advertising, and all that. We've got the natural and built environment. Yeah, we've we talked about that and know some about that. We've got the social environment, the sorts of things that Angela was talking about today. We complex that with social stratification, where we talk about income, education, and the disparities that occur there, and we end up with this differential exposure and vulnerability, which explains some of why we're looking at social determinants here. You add that in with individual factors that we've typically studied, and you get these inequalities in obesity rates and subsequently in chronic diseases. If you look at it from a different way, you say, well, we're public health. What do we have to do with agriculture? Well, there's a lot we have to do. We've talked about some of that here. We know that we have various sorts of agricultural policy that influences production, and that technological innovation also influences what we produce. And thinking like plant and animal breeding, crop fertilization, livestock feeding practices, all of those things which help us to feed the world and help us to help feed the world, which is positive in lots of senses. And then we have all of these things lead to the agricultural choices that are made by producers, which, by the way, are influenced to some extent by what consumer food choices are, but not necessarily. That isn't the primary driver in many cases. We go into agriculture production, agricultural markets get in there when we have our food outputs, be it availability, price, quality, nutrient quality, and the like, and all of these things that have an effect on consumer food choices, the diets they choose, and the diets that are available to them, and then how nutrition-related chronic diseases subsequently develop. So it's all tied up together, and I think we need to think about that. So we need to think about how are our agricultural policies and production practices contributing to or detracting from efforts to get our dietary goals of people having adequate, healthy food at a reasonable price. Where and how could interventions in the agricultural sector help us to get there? Because I think there are some answers and some innovations, and we could, by working with companies such as ADM, and capturing some of their nimbleness and adaptability, be able to kind of work together to improve things for a lot of people. And then to see, are there trade-offs between interventions for agricultural interventions and how we address diet-related chronic diseases. So these are just some things we need to think about. And then back in 2004, WHO issued a report based on various sorts of evidence that they looked at. And we weren't very good about signing on to this as a country, mostly because of what it said about sugar. Anyway, but this is a quote from the report that I think that helps to move us forward, in a sense that our policy should be consistent with the protection and promotion of public health. And that goes across the board because food is part of health. Okay? And while I agree that the private sector has a role, and that we're probably not going to get anywhere unless we work with the private sector, governments should be encouraged to examine food and agricultural policies for their health effects on the food supply, because we don't ordinarily think about that. And most of us in public health say agriculture policy is not my stuff. So thinking about that, and the fact that policy and production often have an effect on national diets, and that government can influence production through policy, although that policy process is quite difficult and quite political, and there are lots of drivers from all of the stakeholders. As the emphasis on health increases and consumption patterns change, these member states of the UN need to take healthy nutrition into account in their agricultural policies. I think that gives us something to think for. And so my question to you, to help lead off the discussion, what is our role in globalization and sustainable food systems, not just for us, but for the rest of the world as well, and what is our social responsibility there?